Greetings, everyone. This is Miss Gibson. So this is lecture 3 over Okay, so after aspirin, we have perochlorobenzic acid. This is indomethacin. It's used for rheumatoid arthritis, gouty arthritis, and osteoarthritis. Can be very irritating to the stomach. Should be taken with food. It may cause fluid and sodium retention as well as hypertension. Next, you have phenolactate, phenolactic acid derivatives. Ooh-wee. This is your diclofenac sodium. This is similar to aspirin, but it has no antipyretic effects. It's used for rheumatoid arthritis and osteoarthritis. It's available in oral or extended release or topical. Next, you have ketorolac, or this is also Toradol. I'm sorry. This has a greater pain. Has a benefit of lowering pain than other NSAIDs. Can be given IM, IV, orally, or intranasal. Has also been shown to have equal or superior short-term pain management as an opioid. Next, we have ibuprofen, which is a propionic acid derivative. It's a relatively new group of NSAIDs compared to the others. It's a little bit stronger than aspirin, but has less GI side effects. It has many drug interactions, such as with warfarin, some of your insulins, some of your hypoglycemic drugs, and calcium channel blockers. Next is your phenamates. This is a potent NSAID. It's used for acute and chronic arthritic conditions. Can have a GI irritation, may also have edema, dizziness, ringing in the ear, and pruritus. Next is meloxicam. This is a long-term anti-arthritic condition such as RA. It does have GI side effects as well, but less than other NSAIDs. It has a longer half-life than other NSAIDs, so usually taken only once a day. Then last, you have selective COX-2 inhibitors. This would be your Celebrex. This is used to treat severe arthritic conditions and has less common GI symptoms than the first generation NSAIDs. Next, I put this on here. This is just a little chart to help you remember aspirin. You're going to watch for bleeding, tinnitus, stomach pain, renal impairment. It can be used as an anti-inflammatory, anti-pain, antipyretic, or antiplatelet. Here's some for NSAIDs, and then your second generation COX-2 inhibitor, Celebrex, or colcoxibid is the generic for Celebrex. Whoops. And then with your corticosteroids, the action of the mechanism of action is they control inflammation by suppressing or preventing many of the components of the inflammatory process at the injured site. They can also be used for arthritic flare ups. It's not the drug of choice for arthritis because of the numerous side effects. Frequently used as anti inflammatory, suppresses or prevents inflammation, does have numerous side effects. You do have to taper the doses with discontinuation. Different types would be prednisone, dexamethasone. Those are the two most common corticoid steroids that you might see ordered. Here's another chart. This has methylprednisone. This is your solumedrol, then decadron, prednisone. The dose amount and duration of use dictate the extent of dependency and damage to the body. Watch for edema, peptic ulcers, delayed wound healing, osteoporosis, and infections. Normally, there is a slow deterioration of the body. Trade-off is treatment with a steroid in a chronic or autoimmune disorder will usually keep the body healthier than if the inflammation process was left unchecked. The good, these drugs stop, control, or reduce the inflammatory response, local or systematic, in any part of the body by suppressing the immune system. Disease modifying anti-rheumatic drugs. This is used when NSAIDs are not working to control the arthritic pain. It's used in rheumatoid arthritis, osteoarthritis, psoriatic arthritis, psoriasis, and Crohn's. One example is an immunosuppressive agent, methotrexate. It's used for refractory RA, which doesn't respond to any anti-inflammatories. It suppresses the inflammatory process. Then you have immunomodulators. This treats moderate to severe RA. It does predispose patients to severe infections, and it's usually very expensive. You can also have anti-malarials. It's used when other RA meds have failed. May take 4 to 12 weeks to see any effects on the body. It's unclear how this works, and it is used in combination with other NSAIDs. So your anti-gout medication, they should be taken with plenty of fluid. You want to avoid foods high in purine, which is organ meats, sardines, salmon, and alcohol. Your colchicine, it inhibits the migration of leukocytes at the inflamed site. It's effective for acute gout symptoms, but not inflammation from other inflammatory disorders. It should not be taken with patients that have renal, cardiac, or GI problems. GI upset is the most common side effect, and that's why you need to take it with food. Your uric acid biosynthesis inhibitors or allopurinol. This inhibits uric acid synthesis. It's used as a prophylactic to prevent gout, and it can increase the effect of warfarin and other hypoglycemic drugs. So you want to do a good med check if your patient's on allopurinol. And then last is your uricosurics. I'm not sure if I pronounced that correctly. It's not something that I'm real familiar with, but it inhibits uric acid resorption. It's not used for acute gout attacks. Needs to be taken with meals to prevent GI side effects, and it's not commonly given. Next is your antibacterial. Your antibacterials work in different ways. They inhibit bacterial cell wall synthesis. It alters membrane permeability. It inhibits protein synthesis. They can inhibit the synthesis of bacterial RNA and DNA, and they could interfere with metabolism within the cell. General adverse reactions to antibacterial is your allergic reaction can be mild or severe. Super infection, which is secondary infection that occurs because normal flora of the body is disturbed. Organ toxicity, damage to organs due to antibacterial drugs, may be organs involved in drug metabolism and excretion. So penicillins, we'll start here. This interferes with bacterial cell wall synthesis. Types, you have your basic penicillins, broad spectrum penicillins. They were initially overused, which led to resistant strains of staphylococcal infections, which led to the development of broad spectrum antibiotics similar to penicillin. They should be taken after meals. They can be given oral, IM, IV forms. Side effects can be anaphylaxis, of course, if you're allergic to them, angioedema, GI upset, and super infection. So your broad spectrum penicillins, these are used for gram-positive and gram-negative bacteria. It is ineffective against Staph NRS. Examples would be amoxicillin or ampicillin. Next, we have penicillinase resistant penicillins. This is what's used for that Staph aureus. It's not effective for gram-negative organisms. An example of this would be nafacillin. You have extended spectrum penicillins used for many gram-negative organisms. Then you have combination beta lactamase inhibitors, or your cillins. This is a combination of beta lactamase inhibitors, which we'll discuss on the next slide, with a broad spectrum penicillin like amoxicillin, ampicillin, or piperacillin. Your nursing considerations would be monitor your BUN and creatinine for decrease in renal function. May have to decrease the antibiotic dose. Some common side effects are hypersensitivity, rash, could be anaphylaxis, super infection, could have some GI disturbances. You always want to take these with food. There is some drug interactions. It can decrease the effectiveness of oral contraceptives. Potassium supplements taken with penicillin may increase serum, goodness gracious, serum potassium levels. If doing culture and sensitivity labs, obtain specimen before starting the antibiotic. Next, we have cephalosporins. They work by inhibiting cell wall synthesis. Each generation a little stronger, more effective than the generation before. You want to watch for allergic reaction. 10% of persons allergic to penicillin also have an allergy to cephalosporins. Only a few oral, rest are either IM or IV. Common side effects are GI upset, increased risk of bleeding, and nephrotoxicity. There is a drug interaction with alcohol. It can cause flushing, dizziness, headache, nausea, vomiting, or muscle cramps. Next is your microlids. This is a broad spectrum, oral or IV. These are your mycin drugs. They are broad spectrum antibiotics. They're active against most gram positive bacteria and moderately active against some gram negative bacteria. Can be given orally or IV, not IM because it would be too painful. Used for infections of the respiratory tract, sinuses, GI tract, skin, or STIs. Your side effects are going to be the GI disturbances, super infections, could be allergic reaction, but those are rare, and hepatotoxicity, which is liver damage in high doses. It can increase serum levels of theophylline and warfarin. If taken together, those levels must be monitored. Antacids may reduce the peak levels when taken at the same time. And one example the of this would be the azithromycin or the Zithromax. Glycopeptides, this is your vancomycin used against drug-resistant Staph aureus for cardiac surgical patients, prophylaxis for those with penicillin allergies. You need to monitor the serum vanc levels, can lead to nephrotoxicity and ototoxicity. Side effects would be chills, dizziness, fever, rash, nausea, vomiting, severe hypotension, tachycardia, rarely cardiac arrest. Can cause red man syndrome. This is when you're given the vanc through IV and it's too rapid. It causes red blotching of the face, neck, chest. Drug interactions increase risk of nephrotoxicity and ototoxicity when taking with furosemide or aminoglycosides. I just completely fumbled through that. Aminoglycosides, sorry. Can inhibit methotrexate excretion and lead to methotrexate toxicity. Your tetracyclines are next. This inhibits bacterial protein synthesis. It is not effective against staph, Pseudomonas, or Proteus. Used with conjunction with other meds to treat H. pylori. Don't take with milk products containing calcium, magnesium, or aluminum. It is suggested to take this on an empty stomach. Has numerous side effects, GI disturbances, photosensitivity. Should not be taken in pregnancy or children younger than 8. Can be nephrotoxic. Can cause superinfection. Drug interactions would be antacids, iron-containing drugs, will prevent absorption. You want to take them at least 2 hours apart. Can decrease effectiveness of oral contraceptives and can decrease effectiveness of penicillin. Your aminoglycosides, this is used against gram-negative bacteria, used for serious infections, not absorbed from the GI tract, can't cross into cerebrospinal fluid, but it can cross the blood-brain barrier in children, but not adults. Your side effects are going to be GI distress, superinfection, ototoxicity, or nephrotoxicity. Some drug interactions would be when given with penicillin, desired effects greatly reduced, and it does increase the effect of oral anticoagulants like warfarin. Some examples of these would be neomycin, gentamicin, tobramycin, your mycin drugs. Next is your fluoroquinolones or your quinolones. They interfere with bacteria DNA for both gram positive and gram negative. Useful in UTIs, bone and joint infections, bronchitis, pneumonia, gastroenteritis, and gonorrhea. Your side effects are going to be anaphylaxis, dizziness, irritability, headache, visual disturbances, GI disturbances, and supra infections. Next is your anti-tuberculars. We only have one that we'll discuss, which is your INH. The CDC states that each year about 9 million people develop TB and 2 million die from it. Patients who start on therapy for TB but don't finish the prescribed therapy can develop and spread resistant strains of M. tuberculosis. To increase adherence to drug therapy, direct observation therapy is recommended. Side effects of this drug would be hepatotoxicity, headaches, GI distress, ocular toxicity, hyperglycemia, hyperkalemia, and hypocalcemia. Next, we're going to talk about antifungals, the azoles. They're divided into different groups. The first one is polyenes. This is drug of choice for severe symptomatic fungal infections. It's given IV. It's administered under close supervision due to risk of toxicity. Side effects would be fever, chills, loss of appetite, nausea, vomiting, headache, tachypnea, and shortness of air. Can be highly toxic. Can cause nephrotoxicity, electrolyte imbalances, and toxic to bone marrow. Your azoles affected against candidiasis and histoplasmosis can be taken orally, also available topically. Your antimetabolites, well absorbed in the GI tract and used in combination with other antifungals. Your last one is the newest class, echinocadians. This is not absorbed in the GI tract and can only be given by IV and is not commonly prescribed. So vaccines is next. This just gives you a chart of the vaccines that are recommended, and it's a immunization schedule. So we know with immunity you have active and passive. With active, this is the body builds the immunity. You have natural acquired, which means you've had the disease before. Artificial would be vaccine. The passive is where antibodies are given. Natural mother to baby. Artificial would be IG to fight specific diseases such as the rabies vaccine. Administration of a small amount of antigen, which, although capable of stimulating an immune response, does not typically produce disease. So you have attenuated viruses. This is composed of live weakened microorganisms. Toxoids, which is an inactivated toxin that can no longer produce harmful disease, but does stimulate formations of antitoxins. This is known as active immunity, such as in the tetanus toxoid. You have conjugate vaccines. This requires a protein or toxoid of unrelated organism. Um, can be recognized by immature immune system of young infants. So it would be the influenza type B. Then you have your recombinant subunit vaccine, where this inserts genetic material of pathogen into another cell or organism to produce massive quantities of antigens. This is used to make vaccines. Vaccines aid in maintaining health by preventing disease. U.S. has more than 20 vaccinations for diseases. Most are routinely administered to healthy children and adults. Other are for special populations. Like the military would have different ones. Also, if you were going to travel to another country, sometimes you have to get different vaccines. Vaccine recommendations. Vaccine schedules are approved by the Advisory Committee on Immunizations. It's a professional association in infection control. The CDC produces a vaccine information sheet, which is a VIS, for each vaccine that shows route, the schedule for each vaccine administration, minimum dosing intervals, contraindications, and standing orders for administration. So, birth to 6 years, you're going to have different ones. Adolescents, and then adults age 19 and older also have recommendations according to the CDC. This is your vaccine schedule. You can click on that link or copy and paste that link. It can be found on the CDC website. Vaccination safety, reporting diseases and adverse reaction. Generally, the vaccines are safe with mild reactions. Sometimes there is some contraindications that you might want to look for. Generally can be given with mild acute illness, or while you're on antimicrobial therapy. Let's see. Healthcare providers are responsible for reporting vaccine preventable diseases and adverse reaction following immunization. Information must be provided at the time of immunization on the indication, age recommendation, schedule of doses, side effects, special circumstances, and resources to notify if adverse effects occur. These are your different types of vaccines. Okay, the varicella vaccine. This is to vaccinate against chickenpox. Since developed, hospitalizations for varicella zoster virus has declined 75% and deaths reduced by 85%. Some contraindications would be previous anaphylactic reaction, untreated TB, immunocompromise, pregnancy, void for 1 month after vaccine. Drug interactions would be maybe given with other vaccines as long as it's in a different site. If not given at the same time, you should wait at least 4 weeks. If receiving blood or blood product transfusion, including IgG, defer as long as 11 months. Rye syndrome has occurred after a natural chickenpox infection. Most patients also received aspirin, thus should avoid these products 6 weeks after the vaccination. Future developments in vaccines: anthrax. There was a small outbreak in 2001, which just increased the levels of awareness. Cutaneous is most common form, 95%, but also occurs in GI and lungs. It's highly lethal and it can be used as a biological weapon, easily produced, stored, and spread over large areas. The vaccines available for high-risk populations like the military, lab workers, and veterinarians. It's 5 injections over 18-month period with an annual booster. If exposed, you can have 3 doses over 4 weeks with ciprofloxacin and doxycycline for 90 days. Then smallpox. This is transmitted through body fluids and contaminated items. It was eradicated in 1972 in the U.S. and worldwide in 1977. U.S. stopped vaccinating in 1972 unless high risk of exposure. Side effects are mild. Since 2001, concerns have arisen. A response plan is available for outbreak emergency should it be used as a bioterrorism weapon. Pertussis or whooping cough. This immunity weakens over time. Adolescents and adults exposed, vulnerable infants. Relatively benign in older patients. Significant morbidity and mortality in infants. The Tdap vaccine contains tetanus, diphtheria, and pertussis boosters should be used in ages 11 to 64. One time in lieu of the TD vaccine. Tdap is used for 6 weeks to 6 years. Your herpes zoster, which is the shingles vaccine, following primary varicella infection, it settles in dorsal root of ganglion, nerve endings. Decades later, outbreaks occur, may be related to decline in immunity. The patient will get a painful rash that presents as a dermatonal distribute. It happens at nerve endings, especially in older adults. Single injection for over 50. For people over 50, those who developed shingles after the vaccine had less duration of pain. The rotavirus, the leading cause of acute gastroenteritis in infants and young children. It's a live oral vaccine containing 5 strands, is effective in protecting against severe gastroenteritis and significantly reducing the need for hospitalization in children. It's administered at 2, 4, and 6 months, with the 3rd dose being recommended before 8 months of age. HPV, this is sexually transmitted virus that causes cancer of cervix, vagina, vulva, and penis, as well as genital warts. Warts can also be on the anus and oropharyngeal areas, leading to anal and oropharyngeal cancer. There are about 100 different types, with two approved vaccines. Vaccines are for the strands that are cancer-related, most effective when administered prior to initiation of sexual intercourse. Administered in 3-dose series, ages 9 to 26. The pneumococcal vaccine, 22,000 die annually in the U.S. from the pneumococcus, from the streptococcus pneumonia. The PPV-23 targets the most common stereotype and is indicated for age 2 to 65 and can be repeated in 5 years. The PCV-13 targets 13 stereotypes for high risk and greater than 65. Incidence of antibiotic resistant disease has dropped significantly since vaccines initiated. And then last, we have bacterial meningitis. This is potentially life-threatening infection. Over 1,000 cases annually in the U.S. 10 to 15% die. 1 to 5 have permanent disability, including brain damage and hearing loss, amputation, and loss of kidney function. Age 2 to 55 should be vaccinated, first dose age 11 to 12, with a booster at 16. And then your nursing care with vaccines, you're going to identify benefits and barriers to timely and complete immunization. You're going to be extra mindful of their beliefs, whether they, do they want the vaccine? Do they have religious beliefs that guards them against getting it? Is there any kind of knowledge deficit? Any kind of ineffective health maintenance? History of malignancy, pregnancy, possible pregnancy, allergy history to drugs, food, vaccines, environmental allergies. Your nursing diagnosis would be knowledge deficit, risk or benefit, health maintenance, or injury risk due to adverse reactions. You're also going to observe for any adverse reaction and educate on that. You want to keep epinephrine readily available in case of anaphylaxis and provide patient with record of immunization. You're teaching, you're going to answer any questions, advise to avoid pregnancy for 1 month after the vaccinations, avoid contact with immunosuppressed if a live virus was administered. You're going to provide the vaccine information sheet as required by law, advise to keep vaccine record and bring to each visit. You're going to provide them a date for the next scheduled vaccine. And then, of course, always teach on your side effects, what the common side effects are, injection site soreness, fever, cold compresses on injection site, acetaminophen for soreness and fever, and advise to contact their healthcare provider if signs of serious reactions are noted. All right, and that finishes up lecture 3 for your medications. If you have any questions or if I have confused you, please don't hesitate to reach out. Have a great day.